Hi, I'm Alison Massey, registered dietitian, certified diabetes educator, and contributor to Diabetes Self-Management magazine. People often ask, what is the best dietary pattern to follow? Although diet should always be individualized to someone's specific health needs and lifestyle, there is one dietary pattern that has been widely researched and consistently is recommended as one of the best patterns of eating for cardiovascular health, and that's the Mediterranean meal pattern. Because individuals with diabetes are at higher risk for cardiovascular disease, it is often a pattern of eating that I encourage my clients to learn more about. The Mediterranean meal pattern has been shown to lower blood pressure, improve cholesterol levels, and reduce markers for blood vessel inflammation. So what is the Mediterranean meal pattern? The Mediterranean meal pattern is generally high in fruits and vegetables, beans and lentils, nuts, whole grains, olive oil, garlic, and fish. It is low in red meat, dairy, as well as sweets and desserts. Here are my tips for switching your dietary habits to a Mediterranean-based meal pattern. Tip number 1, try to incorporate seafood at least 2 to 3 times a week. Fresh and frozen fish are great options when they're available, but don't forget canned varieties also count. Tip number 2, increase beans and lentils to at least 2 to 3 times a week. Use beans to top salad or add beans and lentils to soups and stews. Tip number 3, add nuts and seeds to your diet at least 3 times a week. Add almonds, walnuts, hazelnuts, and even peanuts. Don't forget, a serving is about 1/4 cup. Tip number 4, make produce the all-star on your plate. Use the 50% rule. Try to make 50% of your meal produce-based, either fruits, vegetables, or both, to naturally increase your produce consumption. Tip number 5, cook with olive oil. Add more olive oil to your eating pattern by using it in cooking as well as for making your own salad dressings. To learn more about the Mediterranean meal pattern, check out the resources on diabetesselfmanagement.com and subscribe to Diabetes Self-Management magazine.